Are you done having babies? Like done, as in 150% sure you never want to be pregnant again? Today I'm going to tell you about 3 surgical sterilization options that are greater than 99% effective. Notice I did not say 100. The only way that I can guarantee you will never get pregnant again is, unfortunately, you gotta stop doing the baby dance. Otherwise, if the penis and the vagina are in the same room, there is always a chance for pregnancy. The first one is the vasectomy, or male sterilization. That is actually the most effective form of contraception, and I give a lot of credit to those guys that are willing to step up and take responsibility for their future fertility. The procedure is done in an office or outpatient setting. You'll schedule a visit with your primary care provider. They may schedule the procedure in their office, or they may refer you to a urologist. You will have a formal consultation where they will discuss the procedure in detail to include the risks and the benefits. After the procedure is done, you will be tender for a few days, which is why I recommend having a bag of frozen corn or peas in the house to put on your man parts for your own comfort. After the procedure, you're going to want to abstain from intercourse for the first week, and then definitely use a backup method, such as condoms, until you are cleared by your surgeon. For some men, this does have the option of reversal. However, that procedure is typically not covered by insurance, so I recommend that you make good and darn sure this is exactly what you want to do before you have it done. The second option is what's called a partial salpingectomy. That is a tubal ligation where they remove a portion of your fallopian tubes. It is done in the operating room with you asleep. Your surgeon will make an incision near your belly button and 2 more incisions on the bottom of your abdomen. They will find your tube, they will tie it off, and then they will cut the ends off, sending the tops of the tubes off to make sure that they got tube. So you'll have 2 tied tubes on this side and 2 tied tubes on that side. The reason some people opt for partial salpingectomy is if they change their mind later on down the road, those tubes can be untied and put back together. That procedure is very expensive and not typically covered by insurance, which is why I usually tell my patients, if you are even thinking that someday you may want to have it reversed, you probably should consider using a long-term contraceptive method such as an IUD instead. Last one is what's called a complete salpingectomy, where they go in and remove both tubes. That procedure is again done in the operating room with you asleep. They will make an incision near your belly button, again 2 incisions on the bottom of your abdomen, and they will go in and actually remove your tubes. There is no going back on that procedure. However, removal of your tubes does decrease your risk of developing ovarian cancer by 50%. The tubal ligation again is done in the operating room with you asleep, so it does carry risks: infection, bleeding, pain, complications associated with anesthesia. The most common complication after having a tubal ligation is unfortunately regret. So please, before you undergo this procedure, make good and darn sure it is exactly what you want. So mamas, have you had your tubes tied? And gentlemen, have you had a vasectomy? What was your experience like? Please let me know in the comment section below. And while you're in that comment section, if you want to hit that like button, you know I'd certainly appreciate that.
You're still here. Thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.